Honorable President of Indian Association of Veterinary Public Health Specialists, Honorable Vice Chancellor, and esteemed faculty members of Guru Angad Dev Veterinary and Animal Sciences University, invited speakers and participants. At the outset, I would like to express my sincere thanks to organizers for considering myself worthy of this keynote address. I will be discussing the imperative for institutions in animal health for One Health implementation in India. I'm using the word imperative here as I feel the requirements that we are going to discuss today are vital for the success of One Health implementation in real sense. From implementation point of view, One Health is all about collaboration and convergence of interventions. This important quote of Charles Darwin, you all know about him. What he said is that in the long history of humankind, also in animal world, those who have learned to collaborate and improvise most effectively have prevailed. So this is the essence of what we call the One Health implementation. I'm assuming that we all know about the tactical aspect of One Health, and in recent years you all may be aware that we have very interesting publications that talks about One Health implementation. It gives us a lot of tools to use for building the national capacities for One Health implementation. However, in this presentation, I intend to focus not on these tools, rather some sort of imperative, which I call imperative for implementation from the management, more of a management perspective. So as a first imperative, I would like to discuss on the need for preparing our leadership. This cartoon you must be, you maybe have come across, where we talk about an elephant and all the other people are looking at it from different angles. So what I see is that the leadership in institutions who would like to implement One Health approach must have an understanding of the bigger picture of everything, and he or she needs to inculcate such approach down the line amongst the other leadership within the institution, so that they are ready to work outside their comfort zone. So this big picture thing is very important, and I put it as a first imperative, and probably institutions will do really well when they focus on this particular, what we call as, you can call it as an attitudinal transformation amongst the leaders. Here leader mean not just the head of the institution, but also at people, officers at all levels. The second imperative I think it's all about preparing a business case for One Health implementation within an institution. When I say business case, I mean to say you have to convince your authority regarding why are you going for One Health implementation. This means you need to discuss on the rationale why you are going for this, the evidences, options, that the decisions that you have to take, the value, that is the benefit versus cost, the time scale, the risk associated with the kind of approach you are taking. So all these must be compiled in a better way, what we call as a business case for investment in One Health implementation. There are a lot of resources are available. As I'm saying, you can see on the slide, in 2012 itself, World Bank has prepared a document to talk about economics of One Health implementation. In India, I feel that still we need a lot of research and evidences so that these evidences can be referred by institutions while preparing their respective business cases. So once an institution, based on their business case, get access to resources and decides to develop a One Health implementation plan, the third imperative, what I feel, is the required changes in the organizational or institutional mandate. And this is essential in order to facilitate planning and execution of One Health. Further to the discussion on mandate, the third imperative, I may say the changing the mandate of institutions, I would like to highlight particularly in the case of state animal husbandry and veterinary departments who are willing to, we are very much willing to go for institutional implementation of One Health, but the problem they face is that their mandate in terms of the state allocation of business rules or the rules demarcating the allotted subjects is actually not facilitating such changes. If you look into this example of demarcation of subjects in the case of Government of Assam, where I have been listed, the screen shows you the kind of mandate for animal husbandry and veterinary department. And interestingly, you will not find a single mention of activities pertaining to veterinary public health. The fourth imperative here is the administrative, workforce, and financial innovation. To give you an example, is that we need to bring in the innovation in order to ensure that there is regular information flow amongst the partners when in the context of an integrated project. Secondly, we have to also ensure that there is adequate and equitable distribution of resources amongst the coordinating departments. So this is the fourth imperative in the context of bringing innovation, both in the point of view of administrative innovations, innovation in terms of the human resources required, getting the kind of human resource expected from a One Health project, and the financial innovation, ensuring adequate resource allocation for all the partners involved in the project. The fifth and the final imperative is the innovation in service delivery. Currently, what we see in case of animal health institutions is that we only focus on curative care. I mean, say the majority focus is on curative care, and the approach is firefighting. You wait for emergencies to come and then you go for treatment. But this approach has to change, and we need to focus more on the risk-based plan preventive approach. And this is the only way where you can think of planning in terms of a One Health approach. A One Health cannot work when you are focusing on firefighting and curative care alone. Let's discuss on more on the innovation in service delivery. I would like to request participants to really look into this example and think what can be done in terms of innovation. I'm giving an example of a livestock vaccination program in a forest fringe village, and as you this is a usual activity of an animal health institution to organize vaccination camps. Now you can think as to how you can do a service level innovations in order to ensure that you take an One Health approach. Here I would like to give you a hint out here is that when you talk about from the One Health perspective, we need to see that the livestock population in forest fringe villages should be minimum. we need to say that we need to ensure that there is reduced scope of contact with wild animals, and we develop the required trust on the villagers in these forest areas, so that they become they report diseases. So in this context, when you design a One Health implementation service plan uh, along with your livestock vaccination, you have to take n number of other things, like you can think of the projects or activities which provides alternative livelihood to the villagers. You can think of programs like ecotourism, or any kind of sericulture, or any kind of other things which gives them the alternative livelihood opportunities. Then you can think of stall feeding programs, because we have to reduce the grazing into the wild areas. So there are other ways, like if you again combine work with the health department, that whenever you are organizing your vaccination camp on the site, if you have a health camp for the villagers, this will help you to improve the trust of people on your organization and your projects. So this is how you can bring in a small example as to how you can bring in service level innovation while implementing your existing activities like vaccination. I would like to end the presentation with giving you an example that illustrates all the imperatives that I have discussed. Uh, I thought of discussing about this imperatives with one of my friend who works for IDSP program, the Integrated Disease Surveillance Program of National Center for Disease Control. And IDSP consultant, who is a veterinarian consultant in IDSP, is usually given the mandate of doing the coordination with animal health institutions in order to ensure that there is integrated surveillance, both human and animal surveillance, disease surveillances. So he was describing to me about a situation when there is a report of outbreak of anthrax, and this person, who is an IDSP consultant, he approaches the animal health institution in the state, and he often encounters these type of questions. The veterinarian in charge of that institution, particularly in a particular district, where the outbreak is taking place, he will say that the outbreak that you are referring to is not that serious. It occasionally happens, and there's not much public health challenge, and it's not our priority. So you can link to this particular kind of attitude to the first imperative which I discussed, is the inadequate big picture view and institutional prioritization thereof. So the first two part of the imperative, that is the big picture imperative, and the second one is having the mandate or having the prioritization which is required. Then often the IDSP consultant was telling me, often it comes this question as to, am I required to report from or inform IDSP, or will I be in trouble while reporting? So again, this is related to the mandate, imperative of mandate, because the organizations are not making things clear to its members as to what they need to do. Then the third kind of question he comes about is, we do not get any adequate support to participate in joint investigation. Why should I help you? We cannot help you because we do not get the kind of support that we need for joint investigation. So that means this particular question can be related to the imperative of administrative, financial, and workforce innovation. I hope this example is good enough to give you an idea of the basic, when I say idea of the imperatives that I discussed in this presentation. The discussion on imperative is incomplete if I do not mention the importance of 4 C's of partnership. That is the communication, commitment, coordination, and collaboration. I hope the participants will try to look into this pyramid of 4 Cs, which is critical in terms of One Health implementation. And this, if you look into, is also the if you look into the 21st century critical skills requirement for any person. I say there are the two things. There is a collaboration and the communication. These are the two important skills besides the skill of critical thinking and creativity. Thank you. Thank you very much.